Welcome to fourth video of NEET-PG 2024 recall questions discussion. Starting with question number 31. A patient presented with multiple joint pain, lung involvement, and on microscopy arthrospore was found. Diagnosis: so multiple joint pain with lung involvement, probably chronic fungal disease. This is probably the description of desert rheumatism. The actual question language might be different, but probably the question desert rheumatism was asked and the answer is coccidiomycosis. So desert rheumatism, coccidiomycosis. Question number 32. Sexually active 23-year-old male presented with painful ulcer. So such painful grouped vesicles over his glans penis, and there was no lymphadenopathy. So, and there was also presence of fever and dysuria. So fever, dysuria with this grouped painful vesicle is characteristic of herpes infection. So this is genital herpes, not chancroid or lymphogranuloma venerum. So this is genital herpes. This line is important, group vesicles, and this is painful. Okay. So 33, question number 33. A direct equation was asked. So this is about the maternal death divided by women in reproductive age group. So both numerator and denominator is from same category. So this is definitely rate. So maternal mortality rate, because numerator and denominator is from same segment. If it is maternal death by number, childbirth was denominator, then it should be ratio. If it is maternal death by childbirth, okay, but it is maternal death by maternal women in reproductive age group, I think the rate question was given directly, maternal mortality rate. A 2-year-old child grew increasingly agitated and bites his own lips. So this is the typical description of self-mutilation. So self-mutilation, I think all of you are aware of this term, self-mutilation, with injuries over his wrist, and he has hyperuricemia. So this is typical of Lesch-Nyhan syndrome, which is characterized by self-injury or self-mutilation on suppose these hands, fingers, then head wagging, see the injury mark over so many areas, lips, hands, then your wrist, this ankle joint, dystonia, chorea, hypotonia. This is because of defect in purine metabolism, HGPRT1 gene deficiency. This is X-linked recessive disease, and in this one of the important finding is hyperuricemia because of abnormal purine metabolism, and the complications are like gout, kidney and bladder stone, renal failure, and treatment is decrease uric acid by allopurinol, high fluid intake, and obviously behavioral therapy. In this case also the baby was agitated, obviously behavioral therapy is also needed. So this is characteristic of Lesch-Nyhan syndrome. Question number 35. A 12-year-old girl complaining of amenorrhea. So girl, amenorrhea and short stature. Karyotyping shows 45XO. So total number of chromosome is 45 and only one X chromosome. So this is typical karyotypic pattern of, yes, this is direct question, it is Turner syndrome. The features are like short stature, amenorrhea, shield chest, short webbing of neck, cubitus valgus, lentigens on the skin. So these are the features of Turner syndrome. So 45X chromosome with amenorrhea, short stature. This is description of Turner syndrome. 36. Which of the following disease have same penetrance pattern? So this is pedigree chart is showing X-linked recessive pattern. So this is X-linked recessive pattern, and this X-linked recessive pattern is shown by Wiskott-Aldrich syndrome. So this is X-linked recessive. Wilson disease is autosomal recessive, achondroplasia autosomal dominant. So this pattern is shown by XLR is Wiskott-Aldrich syndrome. Question number 37. A farmer presented with high fever and generalized body ache, calf muscle pain. There was conjunctival suffusion. So farmer, so as all of you heard, rice field, rat and rain. So these three are risk factor for leptospira Wells disease. So any patients or farmer presented with fever, and one of the is important feature is conjunctival suffusion, this might be a case of leptospira. Coming to 38 number question. 6 weeks old boy we presented with recurrent bouts of vomiting. USG features shows this. So as you can see, there is hypertrophy of the pylorus region of this child, and there is narrow passage. So this is typical USG features, and this is distended stomach. So this is typical of, yes, CHPS or congenital hypertrophic pyloric stenosis. So CHPS. Question number 39. This image shows clear-cut question. This is umbilicus with umbilical cord, but here the bladder mucosa is visible. So this is bladder extrophy, also known as ectopia vesicis. So this is not omphalocele or gastroschisis. So this is ectopia vesicis or bladder extrophy. Question number 40. Patient was on chemotherapy. And patient there was features of intractable vomiting post chemotherapy. Patient started on ondansetron, but there was no response. So patient administered aprepitant. So what is the mechanism of action of aprepitant? It is neurokinin 1 receptor antagonist. So answer is MK1 antagonist. In the next segment we are going to discuss 41 to 50. So please subscribe my channel and share the video with your friends, and don't forget to see other videos of my channel like Harrison simplified videos, neonatal reflex videos, clinical videos. So please subscribe the channel for more clinical videos related to NEET or your medical curriculum. Thank you.